So thank you very much, and I'm very happy to be here. It's an honor for me to come and see you all and be able to talk to you about my research. So I'm French. I'm going to try my best to so that you can understand me. I'm really sorry. I apologize in advance. So I work on the history of medical use of LSD since a decade now. And I'm very lucky to be able to do a postdoc on a subject that is very important for me, the impact of women therapists in the psychedelic-assisted therapy field during the 50s and the 60s. So before talking about this movement, when LSD started to be used in medicine in the 1950s, there were two ways of dealing with mental health. It was a time where doctors didn't have any drugs to relieve the symptoms of the mentally ill. And in this context, they had two different techniques during the 50s. So the first one was shock therapy. It was a method that doctors used because they observed that sometimes when a patient were confronted to a psychic shock, he or she could be healed. So they tried this kind of technique. The most famous are the electroshocks, but they also put patients into comas for hours and tried to cure them through this method. It was a very violent techniques, but sometimes it works. So this is why doctors used them. The other techniques is psychoanalysis, but psychoanalysis was not for every disease, not the more severe one, and it was also only for the patients who could afford psychoanalysis. So the techniques that were used daily in psychiatric hospital was the shock therapy. During the 50s, a new technique was invented thanks to the progress in chemistry. Chemists discovered or invented new drugs that could, for the first time, relieve the symptoms of the mentally ill and created this new way in psychiatry, which was psychopharmacology. You administer a substance to relieve the symptoms of mental ills. Two kinds of substances were used and invented in the 1950s. In one part, the neuroleptics and the psychotherapy assisted with psychedelics and mostly with LSD. But first, before psychotherapy assisted by LSD was invented, doctors tried to use LSD as a method of shock. It was very easy to shock patients with LSD because you could inject huge doses of LSD, sometimes 1,000, 2,000 micrograms, without giving any information to the patient, letting them in a hospital room all white, and so they were very, very frightened. They didn't understand a thing about what was happening to them. They cried, they screamed, they vomit sometimes, and you can see from this quote how bad this could be. It is very interesting to read these archives because you really can see that the patients are trying to they request support. They are trying to get this comfort, to be reassured and to understand what is happening. But at first, the doctors never responded to this kind of request. One of the reasons why is because at that time, touch was completely taboo in psychiatry. Some doctors refused even to shake the hand of their patient to say hello because they thought that it will be a problem for the transference process. And it was even more difficult when female patients beg for this kind of contact because every request from female patients was systematically understood as in erotic terms because psychiatrists were mostly men. And you can see also that patients who were left alone in hospital rooms, sometimes doctors or nurses or personal medical staff came into the room to see what was happening with the patients, and patients feel that the doctors or the nurse are making joke or laughing between them, looking at them. Yeah, so it was not the best setting. You have other example here, so you can see that sometimes it was so violent that the patients were attached to the bed. I don't know why they didn't attach also the legs. But yeah, it was very violent. It was here you have some experiments that were done by one of the most famous French psychiatrists of the time in 1959. You can see how bad the experiences were for these female women, the female patients. It was even harder because one woman had the experiment one day and she came back to the other patients and she would say, it's awful, it's horrible what the doctors will do to you tomorrow. And so they begged not to be injected, you can see here. So yeah, it's hard for the patients, it's also hard for the medical team, and it's hard also for the historian who have to read all of this. I don't have time now to elaborate on this, but if you are interested in this kind of experiment, I have a chapter in the next book edited by Erika Dick, who will speak just after me, who explain this kind of treatment that women undergo during the 50s and the 60s. So, gradually, some doctors started to listen to their patients and stop using LSD as a method of shock. They elaborate new techniques for the psychedelic-assisted therapy to be secure, and they invented psychedelic-assisted therapy. And in their history, you can see that we only talk about men in this field. And I was very, very surprised when I started to work on the history of medical use of LSD to discover a lot of women. I choose these three, I will told you just after why, but there was a lot of women, in fact, in this field during the 50s and the 70s. And there were not only women therapists who do their work, but they were very, very famous. They had a huge impact on psychedelic-assisted therapy. They participate in every big conference on LSD. And so they were erased totally from this history to the point that I'm working on this woman since a few years now. I'm still unable to find a picture of Margot Kuttner. If you have any information about one of these three women, please contact me. So I chose to work on these three women in particular because in the first part they had the same way of understanding LSD and they elaborate the same kind of new techniques focusing on touch. They say touch is really important for the patient during the therapy, and touch is an essential part of this new method. So this is the first reason why I choose these three women. And the second reason is that they clearly, frontally opposed to their male colleagues. They say, no, you're wrong. And I am doing the right thing. So it was very interesting for me to work on this very strong woman. So the first one I'm going to present is Margot Kuttner. She was a German psychoanalyst. She escaped Germany in 1938. She was Jewish, and she came in England, where in 1955 she started to work at Powick Hospital, where Ronald Sandison was working also. And you can see here some quotes from her research. She states that patients during the psychedelic experience are in a state of regression, so they start to act and to feel like they were babies. And in this state, they have to feel secure. They have to and be sure that the therapist will not harm them, will recomfort them, and will help them during all this process. And she said a very interesting thing. So touch is a big part of her method, but she said it's not only the therapist who can touch the patient, which were already revolutionary for this time, but it's also the patients who can touch the therapist. So this was a very new and very controversial at that time. All the three women, they focuses on touch in the same way, but they were very aware of the fact that there could be criticisms towards these kind of techniques. Where can we stop? What if the patient attacks sexually the therapist, even more if the therapist is a woman? What they explain is that it's the role of the therapist. The therapist have to do two things. The first thing is to select patients. Every patient could not benefit from the LSD experience, and it was the role of the therapist to do it. It was new also at that time to really select patients before every patient were giving LSD. The second very important thing was to train the patient, to explain what was the effect and what were the rules. You can do this, you cannot do that. You can touch this, you cannot touch that. And they explained that if the therapist choose wisely the patients and explain the rules, the patients never break these rules. It is less emphasis. For now, I'm just speaking about therapists touching patients, but it's very less emphasis, but you can find in their work that they also think about consent from the patient part. How do we touch? Can I touch you? And can I sit with you on the bed? If you don't want, it's okay, I'm not going to be upset, just let me know. You can find this in their work. But as you can see from this picture, taken from a documentary that you can find on YouTube, some male therapists didn't want to see this part, the part of consent from the patients. And it's very shocking for us now to see a female patient in this position, lying on the knees of her male therapist. And it will be very interesting for me to see how this woman dealt with this tension on touch and consent from the part of the patients. The second one I wanted to present is Joyce Martin. She was an English psychiatrist and psychoanalyst. She worked with LSD for almost 15 years, and she had between 1,000 to 3,000 patients with who she used LSD. It's not clear now how much patients she had. She worked both in Marlborough Hospital and here in her private practice. She developed a new technique of psychotherapy with LSD, which she called fusion therapy. It was not for every patient, it was only for very specific kind of patients who lacked basic and emotional love support from their parents during childhood, and when they became adults, this lack had a huge impact on their mental health. And what she proposed was that with this very specific kind of patient, to administer huge doses of LSD, putting them in this state of regression, and then lying in a bed with them during hours sometimes, cradle them, giving them warm milk, so that they can experience a feeling of unconditional maternal love. This is what she wanted to achieve with these techniques. And she had very good results with these techniques. She trained a lot of therapists who came from abroad to be trained by her. As you can see on this picture, taken from a local journal in New York in 1965, she was invited in a LSD conference on LSD by Abramson. I don't know if you heard about it. It's one of the greatest conference on LSD at that time. And it's the only pictures that is in this article, and they choose to present Joyce Martin. And she's not posing, she's not like typical woman of the 16th, posing and smiling, looking pretty. No, she's discussing a point of proceeding. So she is shown in action, really, as the big figure that she was at that time. She inspired a lot of therapists in the psychedelic field, but outside of this field also. And as you can see with Dr. Ruth Fox here, the doctors who worked with Joyce Martin or who read her works feel very free, they feel very more free to touch patients and to have contact, physical contact with them. Stanislas Grof is one of her students. She came to England to study with Joyce Martin. The last one is Betty Eisner. So she was an American psychologist, and she had 2 very bad first experience with LSD. It was absolutely normal at that time to self-experiment for doctors in a way to better understand what was really the effect of LSD. And so she was left alone in a room, and even though she asked for support, she never gets the support she was asking for. And she saw that she would never do that to a patient. She would do it gently. And one thing I wanted to emphasize here is that she clearly opposed to all of her American colleagues who were invented at the same time psychedelic therapy with large doses of LSD in order to create in 1 to 3 sessions a very transformative and mystical experience. And she said, no, we mustn't do that. We should start with very low doses of LSD and gradually increase the doses in order to the patient to understand what is LSD and to accept the effects and to slowly accept to break down the barriers. So it's a very interesting part of her work. She was very linked to all the great thinkers of LSD at that time and psychedelics in general. So she was friends with Aldous Huxley, with Timothy Leary, and Anais Nin, and she was really recognized as one of the most important pioneers at the time. Humphrey Osmond, who coined the term psychedelics as early as 1957, he said that her approach was much more sophisticated than the one of Abramson and Sanderson, the 2 other big psychedelic researchers of that time. And during the 60s, the director of Powick Hospital in England, where Margot Kudner was working, asked her to come and to work with him, but she could not. She had 2 children, and at that time, during the 50s and the 60s, for a woman, it was absolutely impossible to leave or to come with her husband, to ask to her husband to leave and to come with her in England. So they were very famous, they were highly recognized, they published a lot of articles, they were invited in every big conferences on LSD, but there was a lot of refusal to accept their technique from their male colleagues. This is what you can see on the picture here. There were very strict gender roles in society in general and in psychiatry in particular. This is a pictures from the Marlborough Hospital where Joyce Martin was working, and you can see the male psychiatrist. He is standing at the end of the bed in a very restrained attitude, looking vertically to his patients. But the nurse, as a woman, she is sitting next to the patient, ready to take his hand and to help during the process. You can see also the quote from Ansgar Lerner. He was a German psychiatrist, and he said, a motherly supportive procedure is entirely in accord with the personality of a lady like Dr. Martin, while male therapists stress the importance of resuffering and relieving frustrated regressions. So basically what he said is, yeah, it's interesting, but it's for you, you are a woman, this is your world, this is not ours to have this kind of attitude with the patients. So LSD was banned for years, for decades, and now there is new psychedelic-assisted therapy, and you can see that a lot of their techniques are now totally accepted, and you cannot think of psychedelic-assisted therapy without these kind of techniques. But they are never cited, they don't appear in historical work on LSD, they are totally erased from this history. So my work during the next 2 years will be to acknowledge the importance, the impacts that they had on this field, and to replace them in this history. But I hope that it will also enrich the discussion around touch in psychedelic-assisted therapy that emerged in recent years. How do we touch? Why do we touch? Is it really important to touch every patient, and even more with patients who had sexual abuse, and how do we touch this kind of patients? How do we get consent, informed consent, from patients who never had any experience with psychedelic before the therapy? So yes, this is very important question now, and I hope that the work and the experience of the three women that I've presented to you will help with this important topic. I'm really sorry for my English. I'm ready for my... Thank you. Thank you.
That's fabulous. Really, you are touching on some things that really need the attention that you're giving to them. The missing history of women and their influence on this therapy, and also the continually arising questions about the appropriateness of touch and how consent can be properly obtained. These are like the most lively topics that exist right now. So we don't have a lot of time for questions, because what's going to follow Zoe's talk is another talk by Erica Dick, who is also her professor, but we probably could take one or two questions if somebody has a question. Okay, yes.
I'm just curious. Thank you so much for your amazing talk. I'm just curious about what comes up in you. You said it was very difficult as a historian to read, I'm guessing, about the shock therapy and the way that patients were treated. I'm just curious, could you speak about that? I know it's not like scholarly, but I'm curious as a therapist.
You just had an extract here from what I've found in the archives. I also worked on very disturbing archives on two adolescents who received conversion therapy with high doses of LSD. I wrote an article in English if you want. It is in the book Queering Psychedelics that you can find on the table there. So they were 15 and 18 years old, and they had huge doses of LSD, 800 micrograms of LSD and 1,400 milligrams of mescaline injected. So yeah, it was very, very hard to read this kind of archives, and we are not trained to read this kind of things, and we don't get any support from the university, psychological support, to go through these readings. And yeah, it's very hard, and we learn also to writing this history is also a way to deal with the pain that we have when we found this kind of archive, I think. So yeah, it's my way to deal with it, is to write and to explain this history, in order that the new therapists maybe learn the way to not using psychedelics in this kind of way.